Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that affects over 1 billion people worldwide. It's called migraine. More than just a headache, migraines is a disabling brain disorder that can disrupt lives, careers, families. And to help us understand the causes, the symptoms, and breakthrough treatments, we're joined by our expert in regenerative and integrative medicine, Dr. Bryn Henderson. Welcome.
Well, thank you, Dr. Pinsanti. It's great to be here.
All right, let's start from the beginning, and just would like to give an update on myself. I've been practicing medicine for 40 years, and not once have I helped a migraine patient. So I'm leaning to you to not only tell our audience, but to teach me what I've done wrong.
Well, thank you. A migraine is not just a bad headache. It's a brain disorder that affects how the brain processes pain and sensory input. People with migraines often feel a throbbing pain on one side of their head, along with nausea, vomiting, and sensitivity to light and sound. Now, some even see flashing lights or feel tingling before the headache starts. That is called an aura. A typical migraine can last from 4 hours to 3 days.
Do migraines run in families?
Yes, absolutely. Migraine has a strong genetic link. In fact, up to 60% of the risk is inherited. There are even specific genes, you can get into them, that make nerve cells in the brain more excitable. This can trigger migraine attacks. Some rare types, like hemiplegic migraine, causes temporary weakness on one side of your body. They're directly caused by single gene mutations.
Oh, wait a minute. That sounds like a TIA.
The difference is that this isn't a vascular issue. It's not a lack of blood supply.
Okay, so what's happening inside the brain during the migraine if it's not vascular blood supply?
Think of it like a power surge. First, there's a wave of overactivity that spreads across the brain, and we call this cortical spreading depression. This wave affects blood vessels, nerves, and triggering pain. Then the trigeminal nerve, a key pain nerve in the face, releases chemicals which cause blood vessels to swell and the nerves become inflamed. That's what creates the pounding pain and other symptoms of the migraine.
All right, so what are the most common symptoms people should look out for?
The key signs are one-sided. One-sided throbbing of the headache gets worse with movement, plus nausea, vomiting, and sensitivity to light or sound. About 1 in 4 people also experience an aura. These are warning signs like seeing zigzag lines or feeling numbness before the pain starts. Children might have different symptoms, like stomach aches or dizziness. In fact, the criteria here, if I could just sneak in here a little bit, the diagnosis is made because you follow the criteria of the International Headache Society. A patient needs all these little rules. The patient needs at least 5 attacks lasting 4 hours to 72 with specific features, pulsating pain, nausea, light sensitivity, and you have to rule out other causes. You can't have facets that are not related to migraines. The tools like the Midas score and other things are diaries that keep track of severity and frequency of the pain.
Well, I'm going to ask you, what is the Midas score?
That's right. I could have guessed you're going to ask the Midas score. And the Midas score is an international migraine disability assessment score. It's a numerical value that represents the level of disability caused by the headaches, particularly over a 3-month period. So it was derived from a questionnaire that assessed the impact of headaches on various activities like work and school and household chores. It's extensive. It's
okay. All right. So it's something the patient does when they come into your office.
That's
and
right.
Fills it out. Okay. So are there different types of migraine?
Yes, ma'am. The most common are migraine without an aura, just the headache, and then migraine with an aura that includes visual or sensory changes, then a vestibular migraine, usually starting in the back part of the head, and then a chronic migraine, which happens 15 or more days a month. Can you imagine that?
No, I cannot. I've never gotten a headache in my life, so I can't even identify with any of this. How do you treat migraines when it's happening? Because usually the patients come in the middle of it.
For quick relief, we use medications. Those triptans are gold. They're new medicines called GPANs are also extremely effective.
What is the name of it? I don't know this new
That's
GPANs.
a class of drugs. So GPANs are a type of medicine designed specifically to help treat and prevent migraines. That means they work by blocking the action of a chemical, and in this case, it's the one that causes the pain. So GPANs are the first medicine of this kind to be taken as tablets rather than injection. You can use them to treat migraine attacks, and they can be a good option for people who can't take triptan medications. Some people also benefit from the anti-nausea medications. In severe cases, an IV treatment with magnesium, B vitamins can help. We always deal with the treatment to the severity and the frequency. We use intravenous therapies all the time in office, and we even have those that block migraines.
When the patients come in, are they in the middle of the migraine or they're in the aura phase and they go, oh God, help me?
Both. They're in either the aura or it's already coming on. But it is better to do prevention. So the frequent attacks these ladies get, can you imagine 15 days? Remember?
No, I cannot.
Oh my God, that's horrible. So it's like there are some classes, beta blockers and antidepressants that help certain patients. And so you combine them. We actually are blessed because in our office, we have a certified pharmacist. And she has an advanced degree, so she's called an advanced pharmacist. So she compounds and anytime we have something this serious, we have the pharmacist help us right away. So there are also non-drug options. Lifestyle are powerful. So if you get regular sleep, drink enough water, a lot of patients are underhydrated. Manage stress. I think stress causes more than anybody's willing to admit. And avoid food triggers. If you know your food triggers, it's pretty important to avoid them. Many people don't know them. Looking at this, you should also consider transcranial stimulation, TMS therapies.
What is TMS therapy?
That's when you have a magnetic stimulation on the outside of the scalp that actually uses magnetic pulses to calm overactive areas of the brain.
Interesting. Can someone have stem cells and have their migraines go away?
Sure. We use regenerative cells. In fact, we start with exosomes because they're little teeny nanos. And you can sneak them right get into the limbic system, and then they stop the pain. So we begin with the peptides, add the exosomes, and if necessary, we drop on the regenerative cells, and then you can repair whatever the damage is. You make new cells.
Okay, let's talk about traditional Chinese medicine. Is there acupuncture or something for migraines available?
Absolutely. In fact, TCM has been treating migraine for centuries. Centuries, can you imagine?
Yeah.
Acupuncture along the meridians, like the gallbladder and the stomach channels, can reduce pain and rebalance. Again, all of TCM is balance. Getting the body back into balance helps a lot. There are also herbal formulas that have shown effective to reduce frequency and intensity of migraines. We often integrate these into holistic care plans, especially for patients who prefer a natural approach.
Well, what about children? And how do you manage these children with migraines?
Fascinating topic. Children show different symptoms. They're not just little adults. They might feel sick, dizzy, or just want to sleep. We use lower doses of medications like ibuprofen or nasal triptans, and we also encourage proper hydration, good sleep, and regular meals. Preventive meds are used cautiously, and lifestyle changes are especially important.
All right, so I've had 3 patients so far that I've sent to a neurologist that knows how to do the treatment of Botox in the scalp, and all of them said their migraines went away for 8 months.
That's so easy because they're superficial.
Yeah.
And so, since the nerve's superficial and Botox is a paralytic, it will absolutely stop the chronicity of migraines. And it works very well. So, I agree with the neurologist.
All right. So let's now go back to our mnemonic for migraines.
And that's really easy. The migraine relief is
All right. M stands for?
Monitor your symptoms. Use a diary or app to track when headaches happen and what might be triggering them.
I.
Identify your triggers. These can be anything from certain foods and stress to hormonal changes and the lack of sleep.
G.
Get your medications correct. Whether it's triptans, G-pans, or preventive shots, find the regime that works for you.
R.
Rest and recharge. Keep a regular sleep schedule. Both too little and too much sleep can trigger migraines.
A.
Avoid skipping meals. Eat at regular times. Skipping meals or fasting can bring on an attack.
I.
IV therapy can help enormously, especially in emergency settings. IV magnesium, B complex, vitamins can offer quick relief.
N.
Nurture your brain with supplements and nutrients like magnesium, riboflavin, and CoQ10, which helps to reduce attacks naturally.
E.
Exercise regularly. Light aerobic activity 3 to 5 times a week can reduce the number of migraines.
R.
Relax your mind. Stress is a common trigger. Practices like yoga, meditation, and therapy could be powerful tools.
E.
Explore new treatments. Ask your doctor about newer options like TMS, acupuncture, or even regenerative stem cell therapies.
L.
Limit pain medications. Overusing them can lead to rebound, a common issue in chronic migraine.
I.
Integrate holistic care. Traditional Chinese medicine and lifestyle habits can complement modern treatments.
E.
Evaluate your progress regularly. See your doctor every few months to adjust your plan and stay on track.
F.
Follow up consistently. Don't just wait for things to get worse. Be proactive. If you need to follow up every week, it leads to better long-term results.
So yes, migraine can be tough, but it's also treatable. With the right tools, the right team, and the right mindset, you can take back control of your life and your migraines. Thank you so much, Dr. Henderson, for today's episode on migraines. With science, support, and smart care, there is hope. For our listeners, if you or someone you love is battling migraines, have them talk to their doctor. Relief is possible. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.